It has been estimated that over 35 million men and 21 million women worldwide are dealing with hair loss. While it's often normal to shed some strands daily, excessive hair loss can be a bummer and sometimes signal an underlying issue. Science tells us that several factors can trigger hair loss, ranging from your everyday diet and lifestyle choices to your genes and even the environment you live in. So, in this video, let's learn about some of the most common reasons behind hair loss to help you pinpoint your individual reasons and take necessary action. Number 1. Genetics. Genetics plays a dominant role in hair loss. In fact, a 2022 study found that a staggering 80% of hair loss cases have a strong genetic link. This means your family history speaks volumes, with the risk increasing significantly if close relatives have or had hair loss. Number 2. Hormonal changes. For men, the primary culprit is often dihydrotestosterone, an androgen derived from testosterone. Many dermatologists claim that DHT may not only shrink hair follicles, making hair finer, but can also shorten their lifespan, leading to early hair loss. This explains the classic pattern of male pattern baldness, starting with a receding hairline and progressing to thinning on the crown and vertex. Interestingly, a 2021 study identified over 250 genes linked to this pattern, highlighting the role of genetics and hormonal changes in male pattern baldness. Women typically have higher estrogen and lower testosterone levels, so they are less likely to get affected by hair loss due to changes in testosterone. However, menopause can disrupt this delicate balance, making them more susceptible to hair loss. But modern medical science can definitely address these hormonal or genetic changes, so feel free to consult your healthcare expert to get the appropriate treatment. Number 3. Thyroid problems. Every hair in our body has its own growth cycle, comprising the growth phase, regression phase, rest phase, and then shedding phase. Abnormal thyroid function can seriously affect this hair growth cycle. In hyperthyroidism, the thyroid becomes hyperactive, leading to an overproduction of T4 and T3. This surge in hormones accelerates your body's metabolism, causing your hair follicles to spend less time in the growth phase and resulting in thinner and weaker hair strands. Research supports this connection. A 2017 study found that 28% of patients with hyperthyroidism experienced hair loss due to these disruptions in the hair growth cycle. On the other hand, hypothyroidism occurs when the thyroid is underactive, resulting in insufficient T4 and T3 production. If that happens, hair follicles might remain stuck in the resting phase for longer, leading to weaker hair and increased shedding. The slowed metabolism in hypothyroidism also hinders the production of essential nutrients for hair health, making strands more brittle and prone to breakage. A 2018 study showed that about 40% of individuals with hypothyroidism experienced hair loss due to altered hair growth patterns and weakened hair structure. Number 4. Nutritional deficiencies. One of the most crucial nutrients for hair growth is iron. In fact, according to a 2022 study, iron deficiency stands as the most common nutritional cause of hair loss. It affects around 10 to 20% of women worldwide. Iron is essential for transporting oxygen to hair follicles, and insufficient levels can lead to slowed hair growth or hair loss in severe cases. Another nutrient is biotin, which is important for metabolism. It plays a role in breaking down nutrients for hair growth. So, if you don't have enough biotin, your hair might become thin and brittle. Another crucial nutrient for hair growth is zinc. It helps in the production of new hair cells and also helps maintain the oil-secreting glands attached to hair follicles, which play a role in keeping hair healthy. Zinc also helps in the synthesis of proteins, such as keratin, which is a key structural component of hair. Speaking of proteins, hair itself is primarily composed of protein, making it a building block for healthy strands. So, insufficient protein intake too can hinder hair growth and contribute to thinning. Number 5. Certain medications or supplements. Drug-induced hair loss, as many experts call it, affects a significant number of individuals. Warfarin, a commonly used blood thinner, is known to cause hair loss in up to 5% of users, according to a 2020 study. This mainly happens due to its interaction with hair growth cycles. Certain antidepressants, too, have been shown to trigger hair loss. And particularly important for ladies, some medications for severe acne can cause hair loss, accounting for hair loss problems in about 20% of its users, according to studies. Other medications often prescribed for conditions like arthritis, thyroid conditions, high blood pressure, and hormonal issues, too, can interfere with hair growth. Number 6. Excessive hairstyling or products. Using heat styling tools like flat irons and blow dryers too often can damage your hair, causing split ends and even permanent hair loss. Similarly, frequent coloring, bleaching, or perming gradually weakens hair cuticles and follicles, making them prone to breakage and shedding. A 2020 study found that up to 30% of women experience hair loss due to chemical treatments. Plus, overwashing your hair, especially with harsh shampoos, can strip away essential oils needed for healthy hair growth. So, it's important to maintain a balance. If you occasionally color or style your hair with flat irons, that's okay. But avoid doing that too often and use protective measures like heat protectants and gentler formulas to prevent damage to your hair. Number 7. Scalp conditions. Several common scalp conditions can silently damage hair follicles and contribute to this unwanted shedding. One of these conditions is dandruff, which has been estimated to affect a whopping 50% of the global population. It's not just about snowy flakes, as dandruff can happen due to overgrowth of a specific fungus, dry skin, and sometimes due to skin sensitivity to certain ingredients in hair care products. Another common condition is scalp ringworm. Although it mostly affects children, this fungal infection affects adults too. It often shows up as itchy, inflamed patches, and circular hair loss. If left untreated, it can even cause permanent scarring and hair loss. So if you're losing your hair, do not ignore, do not self-diagnose, and do not self-medicate. Always consult your healthcare expert for proper diagnosis and treatment. Number 8. Pregnancy. During pregnancy, rising estrogen levels create thicker hair for many women. After giving birth, the estrogen levels drop, causing hair follicles to move to the resting phase and then shedding phase. Studies have shown that postpartum hair loss affects 40 to 50% of women who have recently given birth. It's common for postpartum mothers to notice thinning hair or patches of baldness. According to studies, postpartum hair loss may start 1 to 6 months after childbirth and last up to 18 months. It is most noticeable along the hairline and in women with long hair. Remember that postpartum hair loss is temporary. Your hair will grow back as your body recovers. Be gentle with your hair and take essential nutrients or supplements as recommended by your doctor to avoid complications. Number 9. Chronic stress. Chronic stress is more than just a feeling. It's a biological reality with a surprising impact on your hair. As mentioned before, hair follicles have their own growth cycle, consisting of periods of growth, rest, and fall. But stress can disrupt this whole process. During stress, your body enters fight or flight mode, releasing cortisol, the stress hormone. While helpful in short bursts, chronic or consistently high stress levels can wreak havoc on hair follicles. In fact, a 2019 study shows that cortisol can shrink hair follicles and shorten the growth phase by up to 30%. This translates to thinner hair and increased shedding. Notably, a staggering 50% of participants with chronic stress in this study experienced hair loss. So probably you can imagine how bad chronic stress can be for your hair. Stress not only disrupts your hair growth cycle, but also hinders your body's ability to absorb and utilize essential nutrients vital for healthy hair. A 2020 study showed how stress can lead to deficiencies in iron, zinc, and biotin, all crucial for strong, healthy hair. These nutrients play key roles in hair follicle function and strength, leaving your hair vulnerable when they're lacking. In some individuals, chronic stress can also trigger an unfortunate chain reaction within the immune system. The body mistakenly targets hair follicles, leading to conditions like alopecia areata, which is very common among men. Hair loss due to stress is surprisingly common. A 2018 survey found that a staggering 73% of respondents reported experiencing hair loss during periods of high stress. This suggests that stress plays a significant role in hair loss for a large portion of the population. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching, and see you in the next video.